Turn now to the latest on the coronavirus in our state. Here's a look at the numbers. The state's positivity rate is at 6.6% this morning. 42 more people have died, and there are more than 1,200 people in the hospital fighting COVID-19 this morning. The country's first coronavirus vaccine is just days away from making its way to the people who need it the most. A group of FDA experts voted last night to recommend emergency authorization for Pfizer's COVID-19 vaccine. Channel 3 Eyewitness News reporter Patricia Del Rio is joining us live right now outside the Department of Health in Hartford. And Patricia, do we know the timeline here in Connecticut?
Well, we have a very good sense of it. What happens next is the FDA needs to give its formal approval, which is expected, and that'll be in the next few days. And then on Monday, Connecticut is supposed to get its first shipment, and hospital workers could see their first shot in the arm on Tuesday.
They deem this vaccine to be safe and efficacious.
Dr. Carl Mingus of the University of New Haven says there is great hope with the COVID-19 vaccine. 16,000 of the Pfizer vaccines will be here on Tuesday, and hospital workers will be first in line. Dr. Mingus says it's very effective in preventing you from getting the virus.
Even after the first dose, it's efficacious, but really it does require both doses for the full coverage.
The long-term effects are still a big question, but the short-term effects don't seem much different than your annual flu shot.
Most of the study participants have had very, very minor reactions in the sense of just sore intramuscular pain, perhaps having a little bit of achy joints, and a slight flu-like symptom.
There were some groups left out of the clinical test. Those with weak immune systems, people who suffer severe allergic reactions, and pregnant women were not part of it. And Mingus says it's common to not see those types of people in the group. However, he says it does mean people in these groups should wait to get vaccinated.
We really need more information from those populations to determine how efficacious it is.
So we also need to see study on how safe this will be for children under the age of 16, but that will be looked at over time. Meantime, after the FDA approves this Pfizer vaccine, next up the following week will be Moderna, and then further on down the pike is Johnson & Johnson and AstraZeneca. So total of potentially 4 vaccines. We're live in Hartford. I'm Patricia Del Rio, Channel 3 Eyewitness News.